Williams, the co-founder and CEO of Materna Health, where we're reimagining care for the earliest stages of pregnancy. At Materna, we're focused on shifting the site of care for complications like Hyperemesis Gravidarum away from the emergency room and towards an outpatient center that's grounded in evidence-based medicine and delivered with empathy. But before I dive into Materna's clinical approach, I want to introduce you to someone who brings a vital and often overlooked perspective to this conversation. Dr. Kathryn Heimos is a two-time HG survivor, a PhD in psychological and brain sciences, and an extraordinary advocate for maternal mental health. With over a decade of research experience in parental well-being and child neurodevelopment, she shows mentors, individuals, and groups and consults with families, healthcare providers, and organizations through her signature HG mentorship programs, including personalized one-on-one coaching and new small group experiences launching this year. Kathryn helps women find clarity, healing, and confidence in every stage of the HG journey, surviving, recovering, and preparing for the future. She'll be starting us off with a deep and personal look at the emotional toll of HG and how we can better support women beyond just the physical symptoms. She will help us prepare physically, mentally, and emotionally for a healthier pregnancy journey with the right support system in place. After Kathryn's section, I'll return to walk you through how Materna is addressing the clinical side of this condition, from early intervention to personalized treatment and care continuity. Together, we hope to offer a more complete picture of what comprehensive and compassionate HG care can and should look like. And just a reminder for everyone to go on mute. I think everyone is right now. And if you could just hold your questions to the end, we will open up the chat for any questions that you have. So now I will hand it over.
Thank you, Kristen. I'm just going to pull up my slides. There we go. Can everyone see those okay? Okay, perfect. So yes, as Kristen said, thank you for that very lovely introduction. My name is Kathryn, and you might also know me as HG Mentor on Instagram. And I'm here today and doing what I do because my first battle with HG was so extreme. And it really changed my journey to motherhood and the path that I was on, and led me down a path of not only transforming my own pregnancy with HG the second time around, but now I'm on a journey to help support and guide the HG warriors navigating this often lonely, confusing, and misunderstood journey to motherhood. So I'm really glad that you're here, and I'm really glad that you took the time to put you and your well-being first and join this call with us tonight. So if you're anything like me, you probably went into pregnancy with a lot of expectations. And honestly, I think it's hard not to, because as young women, we receive very little education and preparation for the realities of even what a typical pregnancy will look like. And oftentimes what we see in the media and social media is a romanticized version of what pregnancy and the journey to motherhood actually looks like. Something that's actually a lot different from what we, especially as HG warriors, experience for ourselves. So I've always had this deep sense that I was meant to be a mother, and I was very excited to be pregnant. This was my expectation, but this was my reality. It's safe to say that I was not prepared for what the reality of my journey to motherhood would look like. My first pregnancy actually baffled my healthcare providers. I went from pregnant to a threatened miscarriage to pregnant to a suspected ectopic pregnancy, and ultimately a non-viable pregnancy of unknown location. After that pregnancy, I actually struggled to get and stay pregnant again, and ultimately we turned to fertility treatments. It was in the early stages of that fertility treatment that I became pregnant, and it stuck. And it sounds strange to say now, but I was actually really happy and excited about those first waves of nausea and vomiting that happened at around 5 weeks pregnant. But I'm sure, like a lot of you, things escalated very quickly, and I was hit with Hyperemesis Gravidarum, along with some very rare and very scary complications. What was meant to be one of the happiest times in my life became my literal hell on earth. Now, trauma is not a word that I use lightly, but my first pregnancy with Hyperemesis Gravidarum was the most traumatic experience of my life. After that pregnancy, I'm sure like many of you, I was terrified to go through any of that again. But at the same time, my heart ached for another baby, and I was desperate to give my son a sibling. The decision to go through pregnancy again after HG is incredibly complex and personal. I had gone into my first pregnancies thinking that it would be beautiful and magical and easy. And when it was anything but, and actually was one of the hardest things I'd ever done in my life, I felt like a complete failure. It was during that first pregnancy that I actually started to question whether I was even meant to be a mother at all. Maybe this was the universe giving me the sign that I wasn't cut out for it. And that went against everything that I had ever believed, because I had known deep down that I was always meant to be a mother. And I know that so many of you have that feeling as well. What I did know was that if I was even going to consider going through pregnancy again, I had to rebuild myself from the ground up, mentally, emotionally, physically. I needed a plan. I needed to feel more in control, and I needed to be very confident that things would be different the second time around. Working in the scientific research field at the time, I was doing a lot of reading and research because it was very important to me to understand what had happened to me and why, both with HG and the complications that I faced. But it was actually a mindset shift that came from an area outside of my expertise that lay the foundation for the path to my second pregnancy and ultimately transformed my journey to motherhood. That mindset shift was triggered by a 2019 research study focused on the limits of human energy expenditure. The researchers in the study stated that pregnancy pushes the body to its absolute limits, matching the energy demands of extreme endurance athletes. Essentially, what they were saying is that pregnancy is equivalent to running a marathon every day for 40 weeks. Many news outlets picked up this study and wrote articles describing pregnant women as endurance athletes. And it was great to see. But I'm sure, like many of you listening right now, my question was, so what's pregnancy with HG then? Running a marathon every day for 40 weeks with a stomach flu? But then I started thinking a little more. If pregnancy is a marathon, pregnancy with HG is an ultra marathon. If pregnant women are endurance athletes, then we as HG warriors are elite endurance athletes. Instead of focusing solely on the negative, I started focusing on our strengths. And thinking about pregnancy as a marathon changed my entire approach. I went from believing that pregnancy was meant to be easy and beautiful and it was just something that I was bad at, to understanding that pregnancy is not easy. It's not something that I was failing at. It was a literal marathon, a challenge that I could not only prepare for, but I could overcome. This way of thinking was completely different from how I walked into my first pregnancies, and it changed the game for me. It gave me the confidence and sense of control that I had so desperately needed, and it became the foundation for how I transformed my own second pregnancy with HG, how I guide and mentor other HG warriors that are walking that same path. So going into my second pregnancy, I was actually finishing up my PhD program, and I ended up creating a case study of sorts on myself. After much deliberation with the issues that I had had in my first pregnancy, I actually ended up deciding to stay with my same medical team, the same hospital, same husband, and I actually ended up having another little boy. So the only real difference walking into that second pregnancy with HG was me and my approach. And my second pregnancy with HG was dramatically different than my first experience with it. And I could talk about those differences for days. But sometimes a picture is worth 1,000 words, so let's take a little look. This picture was taken at around 23 weeks during my first battle with HG. I can actually feel the pain that I felt then by looking in my eyes. I know I'm smiling, but I know how miserable that I was. And seeing how skinny my legs were, remembering the shame I felt for how underweight I was at that stage of pregnancy. I was in a very dark place. I was having severe food aversions. I was unable to keep much food or liquid down, and I was unable to work. And I talk a lot about how low and how bad that pregnancy got. And I think sometimes it's important not to sugarcoat it. I was suicidal. So it was my literal hell on earth. This picture is from my second pregnancy with HG at around 21 weeks. Although I did lose 10 pounds towards the beginning of that pregnancy, by this stage, I had just got back to my pregnancy starting weight, and that's something that I was really proud of. My mental and physical health were good. I maintained my remote part-time job. And at this point, I was starting to wean off my home health care for IV fluids, and I was keeping some food down. And an important contrast to talk about with these pictures is that in my second pregnancy, my symptoms of HG actually started out much more severely. This was not the case that it was more severe in the first pregnancy, and that was the difference. My symptoms actually started off so quickly and severely that I thought I had a major stomach flu or food poisoning. It happened overnight. And I said to my doctor, this can't be HG. This is not how it's going to go. And it was. At around 5.5 weeks, it just came out of the gate and it started very severely. So it was the plan and the tools and systems that I put in place for the second pregnancy that helped me have a much better experience despite my HG being more severe. And now, after having such different experiences with my 2 HG pregnancies, I'm on a mission to share everything that I've learned and help HG warriors navigate this challenging and lonely, misunderstood condition, because a lot of the times we feel like we're navigating it alone. And this marathon shift was more than a change in the way that I was thinking. It was a complete strategy, a different way for me to approach life before, during, and after pregnancy. Just like training for and running a marathon, this strategy helped me break down my pregnancy journey into 3 key stages: preparation, survival, and recovery. Preparation is the training phase. This is what happens before we even conceive, or as early in pregnancy as possible. This is about getting you and your support system ready for HG. Survival is the marathon itself. It's when you're in the thick of your battle with HG, when you really need to lean on that preparation that you have done and the support system that you have built for yourself. Recovery is the post-marathon phase. It's often overlooked and forgotten, although it can be one of the longest and most complicated stages of this journey for us. Whether you're months or years postpartum, this stage is so important because, contrary to popular belief, our journey with HG does not end when our pregnancy does. This HG marathon strategy gave me the structure and hope that I needed in a journey that had felt completely out of my control up until that point. And now this is the same framework that I use to support and mentor the HG warriors that I talk to every day, providing structure, support, and strength for every stage of this journey. Today, we're just going to focus on the preparation phase, what happens before pregnancy or as early in pregnancy as possible. And one of the things I like to say is that when it comes to HG, the best type of action is proactive action. It's about putting the systems and strategies in place to ensure that you do not suffer unnecessarily. And a big part of this is advocating for yourself while you are well enough to do so. There are many forms of preparation that I walk HG warriors through and that I did myself. But here I do want to focus a little bit more on that mental and emotional preparation, because oftentimes when we talk about HG, it's easy to focus on the physical elements of the battle. But I would argue that that mental battle with HG can be just as challenging and if not more important. So that is something that I focus on a lot myself and that I help HG warriors with. Something else that was really important to me was educating myself. I saw the missteps I'd made in my first pregnancy. I didn't have all the information I needed, and without that, I could not make informed decisions. So helping HG warriors understand the science, understand what they need and what's available to them is a big part of what I do. Preparation is also about getting your family and your life ready for HG and having a plan not only for your family, but for a proactive HG management plan so you know what your treatment plan is going into your pregnancy. But I do want to take pause right now because this was an additional mindset shift that I had to make, so I suspect it's one that some of you might have to make too. Because we've talked about an HG pregnancy as being an extreme sport, an ultra marathon. But it's not just an extreme sport, it's an extreme team sport. You can't do it alone and you shouldn't have to. It's about building a support system and a core HG team that can advocate for you and carry you when you are not well enough to take the next step by yourself. I'm not going to lie, this was a learning curve for me. And so I made a framework to help me navigate it for myself. And now I use it to support the HG warriors that I work with. This is your core HG team with your 3 core members of that team. You are the HG warrior at the top. And yes, we do need to lead our own HG journey. So while this is a team, we need to remember that we are the leader of this team. There's your support system, your family and friends, and then your healthcare providers. And you'll notice that the arrows on this framework go in both directions. That's because every element of this team needs to work together to ensure the best possible pregnancy and recovery experience for you, the HG warrior. And creating this framework or image for yourself can be a really nice way to figure out, where are the gaps in my core team? Where are the weaknesses? And when you identify that proactively, you can then take proactive action to strengthen those weaknesses and give yourself the best possible chance at the best possible pregnancy experience. Today, we're going to focus solely on the healthcare providers in your team and finding the right ones, because I'm not going to sugarcoat it. It can be tricky. We still live in a society where there is a lack of knowledge and understanding about HG. And many of us encounter issues in getting the compassionate, informed, and corrective care that we need. I've talked to HG warriors all over the world, and no matter where they are, they tell me the same struggles. These are some of the main ones. Oftentimes, our providers either don't know what HG is, or would be dismissing our symptoms, and we are struggling to get a diagnosis. It's very common, especially in the States, to not be seen by our pregnancy healthcare providers until we are at least 10 weeks into our pregnancy. By then, HG is already in full swing. Struggling to get treatments that we need, such as IV fluids and medications, is a common struggle that we've all faced. And ultimately, we will end up in the emergency room. And I've heard horror stories of HG warriors sitting in the emergency room for hours for a simple bag of IV fluids. Finding the right healthcare providers and building a respectful and collaborative relationship with them is so important and is a key part of your pregnancy preparation. There are many steps and strategies that I walk HG warriors through to achieve this, but I'm excited to say that today we don't need to talk about that, because Materna is meeting these issues head on, and they are going to be providing proactive, informed, and compassionate care to HG warriors. So I'm going to leave it to Kristen to tell you about what they're going to do for that part, but it is so important, and that's one of the reasons that I'm so excited about what Materna is doing. So before I hand over, I wanted to leave you with this. Going back to that core HG team idea. Going into your pregnancy, the goal is to be on the same page from the very beginning. You need to approach your pregnancy with HG as a team with a united front and a proactive plan. And I truly believe that that is something that I and Materna Healthcare can help you with. I know that the journey to motherhood with HG is not easy, because I have been there. So that is what drives me to do the mentorship and coaching programs that I currently have. And you may know about my one-on-one options. They are still available. But as Kristen said, I have a new group program starting this year that I'm very excited about. And all of my programs, they help empower you in pregnancy and motherhood at every stage of the journey with HG. So if you think that I might be able to assist you in any way on this journey, I want you to know that you are not alone. I felt so alone in my first pregnancy with HG, and I am on a mission to make sure that you do not feel like that. If you want to reach out, I'm on Instagram at HG Mentor, and you can email me at Kathryn@hgmentor.com. We can chat, even if you just want to tell me about your HG journey. Sometimes just chatting with someone who gets it can make the world of difference. I do have a wait list for my group program. I'm going to be intentionally keeping the group small because I want it to be intimate and safe and give you time to have a one-on-one interaction with me as well. So I will drop the link for that group, for that wait list in the chat, but you can also get it on my Instagram page and my link in bio. So I'm excited to hand off to Kristen and hear what she has to say, but thanks again for coming, and I hope we have some questions and we can chat a bit after this.
Thank you so much, Kathryn. Very inspirational. Let's take a deeper look in understanding hyperemesis gravidarum, starting with key symptoms. So we're not talking about the typical nausea and vomiting that most people associate with early pregnancy. aka morning sickness. HG is marked by relentless vomiting, extreme exhaustion, and often a complete inability to eat or drink. These symptoms lead to dangerous weight loss, dehydration, and malnutrition, sometimes even requiring hospitalization. In many cases, patients experience symptoms around weeks 4 through 5, and if left untreated, they end up in the emergency room by week 8. One of the biggest barriers to care is getting diagnosed in the first place. Many patients are told that what they're experiencing is normal, and that myth that all nausea in pregnancy is expected prevents women from speaking up. And even when they do, they face systemic issues like living in maternal deserts where care is limited or providers who haven't been properly trained to recognize and treat HG. As a result, diagnosis is delayed or even worse, missed entirely. When care is provided, it's often too little too late. Patients may not be seen until symptoms are severe, and they're sometimes given limited treatment options or forced to endure invasive interventions like PICC lines or Zofran pumps. These treatments carry their own risks, including infection, and can feel frightening and extreme to patients already overwhelmed by their condition. At Materna, we believe that there's a better way. The consequences of untreated HG can be devastating for both mom and baby. Babies may be born early or underweight, with risk for neurodevelopment delays or even structural changes to the brain. Research has linked HG to behavioral changes and autism. For the mother, the toll is massive. Physically, she may suffer from anemia, organ damage, or even Wernicke's encephalopathy, a rare but serious brain disorder caused by thiamine deficiency. Mentally, the isolation, grief, and trauma of feeling unheard can lead to depression, anxiety, or PTSD. Women who've experienced HG in pregnancy are 8 times more likely to continue working at all and lose the autonomy in a time that they need support the most. This is why early, personalized, and comprehensive care is critical. At Materna, we start treating HG before it becomes severe. Every treatment plan is tailored to the individual, as no 2 pregnancies are the same. We take into account medical history, response to medication, and emotional well-being. Our approach includes not just medication, but vitamin-rich IV therapy and evidence-based decision-making at every step of the way. Our goal is to intervene early and comprehensively so we can stop the spiral before it starts. At Materna, we follow ACOG guidelines to ensure clinical excellence. Our patients are seen by the same core team from preconception through early pregnancy, or even throughout their entire pregnancy. It's a team that includes and is led by an ER physician, midwife, and a maternal fetal medicine specialist. We offer frequent IV therapy. Oftentimes, it's 2 to 3 times per week if someone is suffering moderately to severely, to keep patients hydrated, nourished, and out of the ER. We closely monitor medications and adjust quickly based on how a patient responds. We keep in close contact with our patients through a HIPAA-compliant texting platform, so we're able to monitor and see how their symptoms are improving. We avoid invasive treatments like PICC lines because with early intervention, most patients simply don't need it. But beyond the protocols, it is our patient-first philosophy that drives us. We listen, we validate, and we care because every person with HG deserves to be believed and supported. We can open up the chat for any questions or comments.
But I think a question that we often get a lot is how does a woman navigate if her physician is dismissive, or how does she does she switch providers? What does she do if she finds that she's coming upon a physician or a care provider that's just, not really taking her seriously?
I've had a lot of HG warriors come to me with this type of question because unfortunately it is very common for providers to dismiss and not understand what HG is. So I can speak to that briefly. I know we have some more questions coming in the chat, which is great. The position that I come from is that when we can educate ourselves, and if we are too sick to educate ourselves, having an advocate for us that can help educate themselves, is do the research on potential other providers that may be able to help, but also talk to your healthcare provider and take them the research. Arm yourself as an informed advocate and weigh your options, because you have to think about what's best for you and your family. Sometimes at the stage of your pregnancy, it might be working with the provider that you're with and figuring out how to work on that relationship and get the care that you need. Sometimes it's just we need to find someone else. I think it's very individualized, and making informed decisions and being an advocate for yourself is really what I push home with the HG warriors that I talk to.
Well, that's great. I think there's 2 more questions in the chat. Kathryn, if you see them.
Yeah, I think I saw a question come in about PICC lines and how we avoid them. So I would say early intervention is key. We can start treating you as early as week 4 with medications and IV therapy. And we've seen, I would say, an 80% increase in symptoms within 2 weeks of coming to Materna. And it really just prevents the slide of all the symptoms becoming worse. And so we have a HIPAA compliant app where you can text our care team and let us know how you're feeling on the medications. We can make changes, and we have various tools that we can, pull the lever at any given time and help you get through the symptoms and get to kind of a stabilized point that will help prevent those intensive measures. So what causes HG? So there is a geneticist. Her name is Marlena Fejo, and she actually suffered from HG herself and lost 2 children. She is a geneticist and made it her life's work to study why HG happens, and it's caused by something called GDF15. And we all have our levels of GDF15, but people who have HG, their baseline is very, very low. And when you become pregnant, your placenta pumps out the hormone GDF15. And it's that swing that HG patients can't handle and that causes them to be really sick. So it is due to GDF15. Then I saw another question come in earlier about preconception appointments. So for Materna, we will offer preconception appointments. We have 2 types of preconception appointments. We have preconception appointments for those that had HG in a previous pregnancy. We can then evaluate your history. I'm sure most of you know, based on just reading all the research out there, that it is genetic and you are likely to have HG in another pregnancy. Oftentimes it can be worse. So we like to establish a relationship early on, so that way you have your care team in place and you can come to us and we can start the therapeutics and IVs and just work with you very early on in your pregnancy. And then, of course, we also offer just preconception appointments and go through a very thorough history. We can review your nutrition. We can do genetic testing and anything else that would come along with like your standard preconception visit. But I will note we are opening in the fall, so we'll be able to take all those preconception appointments in September. And did I miss any questions that came in?
So there's a
think there's
question
one.
of demarcation between typical morning sickness and HG. I've only had one client who had very obvious HG, but what if a mom is borderline?
So we believe that pain is subjective. There's a lot of patients that I've seen that are not even vomiting. They're just so severely nauseous that they can't even make it out of bed or go to work or just continue daily life. We utilize something called the HELP score, which was developed by the Her Foundation. And we ask that our patients take their score every week throughout their pregnancy just to track their progress. But you don't have to be severe. I mean, you can be moderate or even mild for us to be able to treat you.
I think a mindset shift with that too is really important, because it goes back to that belief that, it's okay to be sick during pregnancy, and we don't have to suffer. We can reach out and ask for help. And one of the things that I had to learn in my first pregnancy was not to wait until I was circling the drain to go and get help, because I had a mindset that, well, this is just morning sickness. I just need to push through it. And we don't need to do that anymore. We can go and get the IV fluids early and be proactive. Like Kristen said, that proactive care can actually prevent you spiraling and getting into a more severe HG situation. So I think that's an important mindset shift that we need to make, and also our support systems and our healthcare providers.
Yeah, and we put the link to the HELP score in the chat. So if anyone wants to use that tool to help assess how severe, mild, or moderate they are, that's a really good objective criteria to evaluate that.
Another question, would your clinic be able to test? So unfortunately, we cannot test GDF15 levels yet. I know Marlena is working with her team to potentially develop a test that women can take prior to pregnancy to see what your GDF-15 levels are and kind of predict the severity that you might experience in pregnancy. And then as far as the metformin trials, I know that she is working with Dr. Householder on that, but I don't have any other information on that. But I do work closely with her, so I'm sure I'll be informed. Oh, wow. Interesting. Could see in the chat that someone is saying that the Mayo Clinic does GDF-15 testing. So that's very interesting and new. I think the most important thing that comes out of this, though, just to reiterate, is that early intervention is really key to success. And it takes a village, as cliche as that sounds, but so many times we focus on the physical aspects of HG and just look at the mom and that physical, what she's experiencing. And there's such a mental toll that we need to really treat it holistically. And it takes a few people to help get through this pregnancy, but we can definitely make it better. Interesting. So someone just added to the chat that some women are working on metformin dosing with Marlena Fejo and Householder, and some of the women are doing really well. Great. Very hopeful for all the research that Marlena is doing with Dr. Householder.
And
Yeah,
along those, I'm
No.
sorry, I would just re-emphasize the importance of educating yourself and being informed, because a lot of new stuff happens all the time. And if your healthcare provider is not plugged into that or reading the recent research of the studies, don't be afraid to print them off and take them in with you. The HER Foundation actually has a lot of clinical guidelines and policies. You can print them off and take them in and use them as a way to even just start a conversation with your healthcare provider. That can be a way that you can advocate for yourself and really back yourself up with some science and research-based strategy.
Yeah, and I was just going to say, as I am a healthcare provider, I'm a certified nurse midwife, and we know that metformin is safe for pregnancy. It's been proven to be safe for a long time. And I know that's one of the things that women that have hyperemesis worry about, is the safety of these medications, and why we don't use FDA classifications of A, B, C, D, X anymore. It was a category B, which is no evidence that it causes any birth defects. There's no human data or animal data that there's any harm. And so women should feel generally pretty good about taking a medication like metformin.
That's interesting. We'll have to keep our eye out for all of Dr. Householder and Marlena's work on metformin. Kristen, can you answer about mirtazapine?
Yeah, so mirtazapine is an antidepressant that's used for depression and anxiety, but also used for hyperemesis gravidarum as well. It's generally considered safe in pregnancy, but this one, the old category, and I know we're supposed to get away from these categories, is a category C. And we do use a lot of category C medications in pregnancy still. So category C means some animal studies show that there could be limited risk to the offspring of animals, but there's no human data, or there's limited human data on the safety of this medication specifically. Really, the issues with the risks have to do with risks at birth. So there's something called persistent pulmonary hypertension of the newborn, or PPHN, which there may have been some links. There's something called, there can be neonatal withdrawal syndromes or neonatal withdrawal symptoms. And so that's kind of like using it more closer to the end. So some people might want to taper a medication like this. And it has been associated with some preterm delivery or low birth weight, although that's also associated with HG and depression, which is what this medication is used for. So it's this medication, more than metformin, is really one that's where what Kathryn said about bringing in the healthcare team and really like talking it out with your healthcare provider. And then because there's so many great AI tools now that can give us access to real studies, beyond what PubMed and Google Scholar can give us, it becomes more of a conversation versus a one-way dialogue from healthcare clinician to patient. And so it's helpful to bring that medication and the information about that medication to your healthcare team. It can absolutely be a great medication and a great tool, especially for after the embryological stage. So after 8 weeks of pregnancy, and then used up until possibly the 9th month of pregnancy, for sure. Definitely. I think that's it. I think that's all of our questions. It was great. Thank you so much, Kristen and Kathryn. It was really incredibly informative and very inspiring.
Thanks for having me. It's been great.
Yeah, and feel free to reach out if you have any other questions or think of something afterwards. All right. Thanks, everyone. Have a great night.
Bye.